Hey there, happy Wednesday evening. My name is Julie Hirschberg. I am the founder, owner of Re+active Therapy and Wellness in the LA area, and back to joining you live on Wednesday evenings to share what we're doing, what we're learning, and in particular, this is what Brittany Charlet and I have been doing and learning together as we've been preparing for our course, which is tomorrow, on 3PD. So I always get the P's wrong. Persistent, perceptual, postural dizziness. I might not have said them in the right order, but that is 3PD. This is something that we see a lot at Re+active. We work with our team a lot, and it's something that Brittany Charlet, our concussion program director, that we teach about. And this is part of our movement disorders fellowship. And we have a course that we are literally doing tomorrow. So we've been deep in the literature. And as we put together kind of those steps of what is that approach for a person with 3PD, one of those key steps is establishing a team for a person and really having an integrated approach. You've heard me say this before. I'm kind of on a soapbox of having a team and really looking and understanding a person from the whole person perspective. PT, OT, psychology, neurology, having all of the people on board. And this is super important in 3PD. So one of the articles, by the way, there were like so many, I had to just choose one, but I have many more I want to talk about, so I'll probably be on here again. One of the articles, and let me actually see if I could share a little snippet of it. Here's what the article looks like. So acceptance and commitment therapy combined with vestibular rehabilitation for persistent postural perceptual dizziness. There's the P's in the right order. And I have to note here, this is a pilot study. This is not a large randomized controlled study. It's definitely a limitation of the study, but it's somewhere to start, which I think when we're talking about 3PD, it's good to start somewhere. So let me tell you a little bit about what they did. And I have the article here because I don't have this all memorized, but they did have 27 people, so not too bad there. 27 people with 3PD. Those people had it for an average of 2 years, so that this wasn't really a new onset of 3PD by any means. And I want to tell you first about the results, because I always go to that results table and I always go to the results section in papers. Now, what is significant is that they use the dizziness handicap inventory to help look and justify whether somebody had an improvement. So of those 27 people, 20 people had improvement, and pretty significant improvement, greater than 18-point improvement on the dizziness handicap index. 11 people had remission of their symptoms. This is what I think everybody with 3PD wants to have and wants to know, is this even possible? So 11 people had remission. So this is a DHI less than 14. That's huge in my opinion. That is a really great outcome. So what did they do? What did they do in this? And I actually find it, some of this was like funny to me. I'm going to be really honest. So the skeptic in me found the vestibular rehab part of this very interesting. I think that could have been improved on, but I think what's really important is the acceptance and commitment therapy part of it. So they did group-based therapy, small groups, 3 people in a group. They did it 3 times a week for 2 weeks. So 6 sessions total. The sessions were 120 minutes long. So these were 2-hour sessions, 6 sections, 6 sessions, boy, that's hard to say, 6 sessions total. And this included the acceptance and commitment therapy along with some vestibular rehabilitation. But this was not, I thought when I read this, I thought, oh my gosh, this is going to be psychology working alongside physical therapy. No, it wasn't. It was psychology and psychiatry implementing some kind of standard vestibular rehab type of things with the acceptance and commitment therapy. So not how I would have done it, not how I do it. I work as a physical therapist. Our therapists work together. We work alongside occupational therapists and psychologists to do this type of approach. And I do think that's something that could have been improved in this study. But let me talk to you a little bit about this acceptance and commitment therapy. This is something I hadn't really heard of before. And it is something that you see now in the literature more and more. You see it in functional neurologic disorders. You see it in all kinds of disorders. As a way and approach of therapy. And to me, and in talking to the psychologists on our team and talking to my own psychologist, a lot of them are trained in many different approaches and use an eclectic mix of things to help people based on where they are. Not one psychologist do I know subscribes to one thing and uses it every single time. So I do think that's important, and that is not what I'm proclaiming here is everybody should have acceptance and commitment therapy. But the idea is intriguing to me, and I want to quote a nice part of the article that talked about the acceptance and commitment therapy. So I'm going to read it here. So they say acceptance and commitment therapy, or ACT, is the third wave of behavioral therapy that aims to increase engagement in activities that bring meaning, vitality, and value to the lives of patients experiencing persistent discomfort or distress, and helps them to accept the discomfort or distress and not control it. And for a person who likes control, I found this so interesting, and I liked this description of it. So one of the things that many authors have talked about when they moved into the ACT for some of these diagnoses is that they've noted that cognitive behavioral therapy, while effective, may not be long lasting, may not help as many people as it should. And so therefore, they have looked at implementing maybe a different method, including this ACT method. And I think particularly in a lot of chronic disorders where there might be a person experiencing, by the way, can you see my dog's tail wagging? I was like, what is coming out from behind me? It's not me, it's my dog's tail. Let him out. That was so funny. That's Drake. So the acceptance and commitment therapy, when for a person with a chronic disorder with a lot of disabling symptoms that are fear-inducing, which dizziness is one of those, right? Like if you're experiencing chronic dizziness, you're going to be worried that you're going to have a dizzy spell somewhere, or you're going to be worried that you can't do things. That would be normal. And what can be found and what we find in the therapy is that you actually need to experience some of the dizziness to overcome the dizziness. So it's that kind of notion that what is hard also heals you. So it's that graded exposure to dizzy activities. Well, turns out this acceptance and commitment therapy helps people to actually do just that, accept some of that discomfort and move through it, because that is actually part of the vestibular rehabilitation, or just what I would say rehabilitation for 3PD, is actually being able to access some of your resources to be able to move through some of the dizziness. So it makes a lot of sense that this could be very effective. Now, let me talk you through what they did. And they actually include a really nice table. Let me actually see. Let me see if I can share a picture of the table here. I think I can. Oh, it's not there. Okay, I apologize. I will share it on our stories, because the table goes through. And by the way, if you're on our newsletter, I'll send out a link to this article so that you can get all of this. But they shared an overview of the ACT plus vestibular rehab that they did. So 6 sessions, session by session. They did education about 3PD, the causes, the cycles of persistent dizziness, the hopelessness associated with it, the lack of control, for example. And they introduced vestibular exercises as mindfulness exercises. And I think that's a really interesting idea. And so they did some basic head turns and eye movements. I certainly would want to test things out and prescribe those a little more precisely for the person, because not everybody needs this and not everybody needs this. And in fact, many people don't need it at all. They might need some sensory reweighting, or they might need to induce motion and challenge their otolith sensitivity. So this is where I disagree with some of this, but hey, you know what? Even with that, 20 of the 27 people got better. 11 people got in remission. So, hey, if you actually added individualized rehabilitation, physical rehabilitation to this, I feel like, oh my gosh, maybe everybody would get better. So again, session 1 is a lot of education. I feel like, you know what? That's what a lot of what we do. Session 2 is a values clarification. I love this part of acceptance and commitment therapy. They do a values clarification, like a values card sort. Maybe you've seen this as a part of motivational interviewing. So basically taking in what you actually value in life. And they start incorporating some grounding things, one of my favorite things in 3PD, in some mindfulness exercises. Great, I love it. Session 3, they do acceptance. So letting the dizziness be just as it is. And this is also a really nice mindfulness-based activity as well, is just noticing it and accepting it where it is. And so they include that part of the ACT with mindfulness exercise and meditation. And they start taking or making some committed actions. So taking actions on your values in everyday life. This to me is where I love the intersection of psychology and occupational therapy, particularly with our occupational therapists who are very lifestyle oriented, is like, what are those values and how are you finding meaning and purposeful activities in your life? If you have ever lived with dizziness, which I have, you will know that it can be very hard to do your normal, meaningful, purposeful activities. So doing a values clarification and then finding a way to live out purposeful and meaningful activities again is so important, and it's a really important part of recovery. So that was number 3. Number 4, another big part of acceptance and commitment therapy. By the way, huge shout out to Dr. Melissa Matos, one of our psychologists, because she's the person that first introduced ACT to our team and helped me understand the terminology. And I learned all of this in one of our integrated team meetings. I'm so thankful for her. So cognitive diffusion. So observing some of your thoughts at a distance. That was in this is the 4th session that they did. And again, mindfulness exercise and a committed action. Number 5 was another part of ACT, self as context. So observing your own inner events such as feelings, thoughts, physical sensations, combining that with mindfulness activities. You can see why they had 2-hour therapy sessions. This is a lot of stuff. And then finally, in their last section, mindfulness exercises in everyday activities. So mindful drinking and walking. Mindful walking is one of my favorite activities as well. And then taking action. So that's it's a little table, a really brief overview of what they did week by week. But I think it gives us a lot of ideas, whether you're a psychologist working with somebody with 3PD, or some of these activities that you might incorporate as a physical therapist or occupational therapist. And honestly, to me, what it says is like, it takes a village and it takes a team. How are we going to address all of these things flying solo as a physical therapist? I personally would much rather do it as a team. So this is for us, 3PD is another program that we offer as an integrated approach to care with PT, OT, and psychology. I think it's really important. I should mention too, PT, OT, psychology, as well as yoga and fitness, because exploring some of those fitness activities in a graded way is also really important for people. So there you have it. Let me pull up that article again just to show you. We just did a quick little review of the findings that they had in the acceptance and commitment combined with vestibular rehabilitation for 3PD study. This is part of really recent literature. This was from 2020 that we're sharing in our 3PD course tomorrow. And just what I'm sharing with the world with you all tonight. So again, if you're not already part of our newsletter, you can go to reactiveeducation.com, sign up for our newsletter. I'll send out the links to this article as well as several more that show the benefit of integrated therapy in 3PD. I'll send out this video to you all as well. And I just want to say thank you. Thank you for joining me tonight. Thank you for joining me in general on this journey that we keep learning and keep going through life together. So thanks so much and have a great night.